Each year, worldwide, over 250,000 pedestrians are killed in traffic. Millions of pedestrians are maimed or injured. Join us for the next half hour as we look for solutions on Perils for Pedestrians. On this episode, we drop in on the National Walking Summit in Washington, D.C. Then we learn about the Everybody Walk Collaborative. We talk with the Surgeon General about his call to action on walking and walkable communities. Finally, we attend the release of the Call to Action. Stay tuned.
We're in Washington, D.C., talking with Tyler Norris with Kaiser Permanente. What do you do for Kaiser?
I am Vice President of Total Health Partnerships, which means that I build the internal and external partnerships to bring Kaiser's whole value proposition to the communities that we serve.
So what's been going on in Washington this week?
Well, it's been an amazing week. We just wrapped up the second National Walking Summit, which is the focus of getting more people walking and to create more walkable places. We had 500 people from virtually every state, 5 countries, and as the second summit, it was just extraordinary how this has gone beyond walking and walkability to really be more about authentic, resilient, equitable community development, and all the way to really how we transform the health of the nation.
How does that fit in with Kaiser's mission?
Well, as a nonprofit, mission-driven health organization, integrated delivery system, we offer care and coverage. So in our model, we actually do better when people are healthy. So we invest in things that create health, and one of those is physical activity. Of course, we care about nutrition and sleep and cutting tobacco and the rest, but physical activity we know is one of the simplest, least expensive, powerful things that people can do for health. So supporting the growth of the Everybody Walk movement in the United States and making grants and doing partnership work with nonprofit organizations and community-based organizations that are increasing access to safe places to be active is a really core part of our mission. In other words, if our physicians are prescribing physical activity, sort of creating the demand side, we're investing in a supply of safe places for people to be active that at the same time start to regenerate the economic development of those places.
So what sort of people were at this conference?
Well, it was amazing. The speakers ranged from the U.S. Surgeon General to the head of the National Highway Transportation Safety Administration to our closer, Ron Sims, a former administrator of Seattle-King County. The people that attended ranged from mayors who are looking at a walkable community as a stronger, more resilient economic development, a place to attract workers, a place to attract companies, to walking and biking organizations that are trying to make increase access to safe places, to people who are interested in the environment and reducing our carbon footprint by getting people out of their cars and using more active forms of transportation, transit professionals who are trying to get more of us to use transit, and the benefit of that is, of course, every transit trip begins and ends with a walk trip, so that we know we get physical activity. So we essentially had kind of a mix of people who across sectors care about walking and walkability for different reasons. For us, it's about health. For others, it's about economic development. For some, it's about the climate. For others yet, it's about equity. But all of us are aligned around the same strategy, which is to increase people walking and biking and to create more safe places to do that.
And some of the attendees went up to Capitol Hill on Wednesday.
Yeah.
What's the story on that? What's the role of the federal government in making this all happen?
Well, a lot of the work that needs to happen is local, and we know that. Change happens locally, and there are opportunities with our federal highway and transportation reauthorization and other important pieces of legislation that can make sure that those our national taxpayer resources are applied to communities to increase access to safe places, safe routes to school, the complete streets, which makes sure there's routine accommodation for bicycling and pedestrians, increase access to parks and open space and land trusts. And so there were hundreds of people hosted by America Walks, had I think 147 different meetings on the Hill with congressional staff and a number of members to help them understand what's working in a very bipartisan way on the ground, and how, as elected leaders looking at federal resource allocation, how they could be making sure that the policies that we're advancing from DC are matching what Americans are saying they want in their own communities. And that was really the connection of Walk the Hill Day.
And a couple of speakers brought up the issue of equity.
Yeah.
How do equity and walking go together?
Well, they actually are joined at the hip. Many of us are fortunate enough to live in neighborhoods with sidewalks, with zebra striping, that are safe neighborhoods where we feel more comfortable with our kids walking or biking to school, or our spouses or our families being able to get out on the street. And yet far too many Americans live in communities where it's just not possible, where the streets are not safe, there are not sidewalks. People of color, young people, and seniors are disproportionately hit by cars when riding their bike and walking. And so walking is essentially not accessible to everyone. And the message here is that walking ought to be we're pedestrians by nature, and walking and rolling ought to be a human right. And so the question about how do we make sure that that's accessible to every American, not just those that are fortunate enough to live in a nicer neighborhood, is a key. We don't think walking should be a privilege. Walking ought to be a right. As a healthcare organization, we care about equity because we know that our more vulnerable populations, communities of color, lower income folks, have worse health outcomes. And so as a health system who is committed to improving the health of Americans, we want to invest disproportionately in communities of color, in vulnerable neighborhoods, to make sure that we have a true equity of opportunity for people to realize their full health potential.
We just sent people home a couple hours ago. What was the charge given them? What should they be doing once they get off that airplane flight back where they live?
Well, the first of those is to really understand how powerful this simple idea of walking and walkability is for our health and for the transformation of our communities. And really to begin to help articulate that to different sectors, to talk to our mayors about how a walkable, bikeable, safe community helps support economic development, to work with our environmental leaders to understand how this walking and biking movement can be part of helping us reduce our carbon footprint and address climate change, to work with our nonprofit organizations, particularly those that are working on social justice or environmental justice issues, to ensure that everything that we're doing is working for the less fortunate of us, and that there are parks and playgrounds and not only safe routes to get to school and work and the park and the shopping and church and services that people would access, but also destinations that are great places for kids and people of all ages to really play. So in a way, it's keep doing what we're doing and growing this movement, and also helping understand how we can build these partnerships across sectors with people who may have different missions: economic development, equity, physical activity, health, but for whom the strategy is the same, a convergent strategy, which is to get more people out walking and biking and rolling and create safer places for people to do that.
We're in Washington talking with Joan Dorn, who's co-chair of the Everybody Walk Collaborative. What is the collaborative?
John, the collaborative is a group of people from all different sectors of the country who are interested in making people healthy, making our communities safe and more walkable.
And who are the members? What sort of people belong to the collaborative?
The collaborative is a unique, diverse group of people. We're diverse in our education, we're diverse in our careers, we're diverse in our ages, we're diverse in our ethnicities. So we have people from public health, we have people from urban planning, we have people from transportation, we have people from foundations like AARP, the American Heart Association, American Cancer Society. We have people who have started walking groups for people who would normally not walk, like Girl Trek, that's designed to get African American women together to walk for a cause. We have people who got us together because they like to walk their dogs, Peds and Pooches. So it's people who are committed to making our country, our people healthier, and using walking as a way we're going to do that.
You know, how long have you been around, and how did you get started?
I have been involved since the very first few meetings because prior to my current position, I was the branch chief at CDC. in physical activity and health. And we had produced a document called Vital Signs, and it actually was some good data showing that Americans were walking more, but not enough. And so at the same time, Tyler, Jim Whitehead from American College of Sports Medicine, and Russ Pate from the National Physical Activity Plan met with Secretary of Health and then met with Regina Benjamin and said, we have a real problem here. Americans are not getting enough activity. It's almost in an epidemic proportion. What are we going to do about it? And she said, well, I think we should write a call to action. I'll write a document to promote physical activity. And as that story started to evolve, the walking vital signs came out. Many people were already involved in walking, and so we got together here. She made her life easy because she publicly announced her intentions for a call to action, which allowed us to sort of broadcast that and unite people, and that's how I got involved. I'm now in an academic institution, still wedded to making people more healthy, still wedded to making communities more walkable, and have been involved ever since my position at CDC. And I now live in New York City, where there's the assumption it's walkable, and there are a lot of sidewalks, but there are many parts of New York City that are not safely and pleasantly walkable.
What was the role of the collaborative in helping draft the Step It Up call to action for walkable communities that just came out a month ago?
So, well, the drafting was actually done by many people in the federal government at CDC and at HHS, but the collaborative had the first meeting to launch it. The collaborative held a subcommittee where we brought in a group of experts from the various sectors to give us their input on what they would like to see in the call to action. Part of the putting together the document was a Federal Register notice, so the collaborative pushed out to their members, now's your time, put what you want to see in there, voice your concerns. We got so many comments. It was at that point, it was one of the most commented Federal Registers that CDC had at that point. So had it not been for the collaborative, I don't think we would have had the reach. And I think as things transitioned, when Dr. Benjamin left and Dr. Lushniak stayed on, they made sure that baton got passed and was supported. Not that we had to argue, because both of them were incredibly supportive of it. But then when Dr. Lushniak left and Dr. Murthy came in, there was this momentum behind the document already that probably would have made it challenging not to finish it and get it out there. They've been the voice. They've made sure that it stayed on the radar screen, and now they've been incredibly active in the launch of it and the promotion, and look forward to doing more to make sure it's not a document that stops doing anything good in the next year or so. It keeps on going.
What was the role of the Everybody Walk Collaborative and the National Walking Summit that just ended?
They were instrumental. America Walks is the backbone, but the collaborative, again, the messaging, the connections, the idea generations, the enthusiasm. The collaborative provided the opportunity to bring sectors together that, had they been done in public health alone or had they been done in transportation alone, would never, ever have gotten in the same room at the same time and done all the great things that's happened here in the last few days.
And you're a little busy with the call to action, but conference just wound up, so that frees up a little bit of time. What's the collaborative looking forward to doing in the future?
Well, right now in 2 hours we have the collaborative board, and that's exactly what we're talking about. What are the big take-home messages? What are the achievable things as we push this forward? And what's our specific role? We're going to try to narrow it a little bit and do something powerful and good, rather than maybe thinking about being too many things in too many places. So the strategizing is taking place as you and I are speaking, what that next step will be.
We're in Washington, D.C., talking with Vivek Murthy, who's Surgeon General of the U.S. What did you do this morning?
This morning we released a call to action on walking in walkable communities. The message of this call to action is that walking is a powerful tool to improve your health. And we're asking people to not only build walking into their lives, but to help other people build it into theirs.
What does it mean when the Surgeon General's office releases a call to action?
A call to action brings together scientific information about a topic, but very importantly, it also puts out a request to the community to engage in efforts that will translate that information into real change and improvements in health. And that's what we did today, is we brought together partners from across the private sector and across government to come together to identify ways that they can improve walking and walkability in their communities and to make concrete commitments to how they were going to do that.
How can people get more information about the call to action?
Well, the call to action is available on our website, surgeongeneral.gov. There you can download a copy of it. You can see how walking can help you in your life, improve your health. You can see how walking just an average of 22 minutes a day can actually reduce your risk of heart disease and diabetes. And you can also learn about the various organizations that are involved in helping to translate the call to action into better health. But I really want to thank all of you for being here today. It is wonderful to see so many faces out there that represent the array of partnerships that we are putting together to make physical activity part of America in an even bigger and more healthier way. I'm glad to see our chief professional officers here from the Commission Corps, to see leaders from so many public health organizations, to see leaders and partners from within government, from across sectors, not just from the Department of Health and Human Services. But in particular, I would like to thank Dr. DeSalvo for her remarks and for all of her support in the creation of this report. As many of you know who have had the chance to work with Dr. DeSalvo, she has been a tireless champion for public health long before she came to Washington, D.C. And one of the great privileges that I've had as Surgeon General is the opportunity to work with her as a colleague and as a friend. So thank you, Dr. DeSalvo, for being here. I also want to thank Vanessa for that warm introduction, and most importantly, for the extraordinary work that you do. You know, thanks to Vanessa, there are 35,000 and counting young women and girls all across the country who are walking to improve their health and who have built a movement out of that. And it's because of work like what Girl Trek is doing that we have been able to come together and have days like this. But there's also something else that Vanessa and I share in common, which is that we are both part of a corps. You know, your Army, Vanessa, the Girl Trek Service Corps, and my team, the United States Public Health Service Commission Corps, may not look the same. They may wear different uniforms, but they share a common purpose, which is to help build healthier communities all across America. And that's appropriate because communities are the focus of today's call to action. As a community and as a country, many of you know that we face great challenges. Where you live today can be an all too accurate indicator of how healthy you'll be. Health disparities continue to grow in too many of our communities. And I'm particularly concerned about the explosion of chronic diseases, such as diabetes, heart disease, cancer, and obesity, that are responsible for 7 out of every 10 deaths now and cost us over $1 trillion in healthcare costs every year. As a doctor, I've also cared for many patients who have had chronic illnesses, and many of these illnesses, I have noted, could have been prevented. I've sat by the bedsides of these patients. I have talked with them and their families long into the night, and I have witnessed firsthand the kind of suffering that chronic illness can cause individuals and families. And that is why when I became Surgeon General, I vowed to take on this epidemic of chronic disease as a central focus of my tenure. It turns out that one of the most powerful things that we can do to turn the tide on chronic disease is something that we have been doing for millennia, and that is walking. In the last few decades, though, we have lost touch with physical activity. It's slowly vanished from our workplaces. Our children have less and less opportunities in school to be active. And in our neighborhoods, we find more and more people who are encountering difficulty with walking, including important and major safety issues. Additionally, for too many seniors, communities of color, for too many people living with disabilities, and for too many of those who are economically disadvantaged in our country, the lack of walkable spaces has become a health equity issue. But today, we have the opportunity to reclaim the culture of physical activity that we once had. And today, we are here to make that commitment that in America, everyone deserves a safe place to walk and to wheelchair roll. And that's why today I'm releasing this call to action on walking and walkable communities. It's a copy that all of you should have on your chair, but that everyone can download at surgeongeneral.gov as well. And in my own life, walking has played an important role. So this is a personal matter to me as well. To me, walking now means building in time in my day to catch up with my wife, Alice, about how our days have been. It means getting out from behind my desk at work to do walking meetings and to get fresh air with colleagues. It means happy memories as a child, going on walks with my parents and with my sister, something we still do to this day when I go home. And the science on this topic is also clear. It tells us that an average of 22 minutes a day of moderate physical activity, which comes out to about 2.5 hours per week, can significantly reduce our risk of diabetes and heart disease. And physical activity can have additional benefits as well, including improving your mood, reducing stress, and building connections with other people, a sense of social cohesion and community. Walking, as it turns out, is one of the easiest and most affordable ways to build physical activity into your life. You don't need a fancy gym membership or a special set of skills to walk. It's something that all of us can do. And let me be clear that this is something that is part of who we are. We are, in fact, a nation of walkers. We're walkers who use our feet. We're walkers who wheelchair roll. We're walkers who use a cane. We walk in different ways, but we all walk. And at so many times in our nation's history, walking has been a symbol of and a vehicle for inclusion. Whether it was Martin Luther King's March on Washington, the women's suffrage procession of 1913, or the Capitol Crawl, where men, women, and children with disabilities showed the world that they too deserved access to the nation's capital. So when we talk about walking today, it's a reminder that this is a movement where all of us play a critical role. In this call to action, we've laid out strategies that will help us build healthier communities together. To do it, though, we need to make walking a national priority. Now, if you think that that change is too hard, if you think that building a community where people can walk is just too difficult, that it's not possible, then I'd ask you to think about West Wabasso, Florida, in Indian River County. There, in West Wabasso, 11 years ago, more than half of the residents were living below the poverty line. The roads were unpaved. There were few sidewalks. There were few streetlights or safe public parks. But then the community made a decision to change this, and they came together to do so. And over 2.5 years, the Indian River County Health Department worked with the residents and the local government of West Wabasso, and together they created safe public spaces for walking. They installed streetlights and sidewalks, and they improved local parks. And what did they find? They found that when they were finished, 95% of residents said they spent more time outside than just 2 years prior. 95% of residents. That is extraordinary. In West Wabasso, they built a healthier, walkable community because they believed in it and because they made it a priority. And that's the only way that we're going to rebuild a culture of physical activity in America. It's if every sector steps up to the plate. It's going to take a full team effort, and we need to support walking where people live, where they learn, where they work, and where they play. So if you're somebody who doesn't walk today, I'm asking you to build walking into your life at work and at home by taking the stairs, by holding walking meetings, and by spending more time with the people you love in walking. If you're somebody who already walks, I'm asking you to help your family and friends walk too. And you can do this by having them walk with you. And if you're somebody who already helps others, then take the next step and help us build more walkable communities for everyone. Today, 30% of Americans report that they don't have sidewalks in neighborhoods. But we can change that. We can change it by city planners, transportation professionals, and local government leaders working together to improve the safety and walkability of neighborhoods for people with all abilities. Community leaders and law enforcement can work together to make sure that no American is ever feels unsafe walking out the door. We know that people with access to parks and green spaces walk more than those who lack access. Employers and employees can also work together to build activity breaks into the workday to go on walking meetings and to get each other to take the stairs instead of the elevator. And healthcare providers and patients can work together to develop plans for physical activity while connecting to community resources like the Exercise is Medicine program is doing. And educators can work with parents and kids to build activity into the school day, something that we have lost all too often in too many schools. And they can also work together to create safe paths to school, like the walking school bus programs, which have been implemented in Massachusetts, in Virginia, in Rhode Island, and in many states, which can not only get kids walking, but can also boost school attendance as well. We are all gathered here today because we know, in the end, that America's greatest source of strength is ultimately our people. We cannot be a strong America unless we are a healthy America. And in the face of this truth, walking stands out as a simple yet powerful step that we can take to building a healthy and strong country. And that is why I am releasing this call to action on walking and walkable communities. We will succeed in this effort if we work together as communities. We will succeed in this effort if all of us work together to ensure that everyone has a fair shot at better health, to make sure that everyone has the same opportunity to walk. And if we work together, if we step it up, we can do what West Wabasso and communities all across the country have already started doing. We can rebuild a culture of physical activity and health in America. And now I'd like to take this opportunity to invite some of our partners who are already on the stage to share with you some exciting announcements that they have to make. And in particular, I'd like to recognize Dr. Brian Hainline, Chief Medical Officer of the NCAA, Dr. Jack Groppel, co-founder of the Johnson & Johnson Human Performance Institute, Dr. Robert Salas from Kaiser Permanente, which has been gracious to host us here today, which we thank them for, and Ms. Betsy Laird, Senior Vice President of the Office of Global Public Policy at the International Council of Shopping Centers. And if this sounds like a diverse and perhaps potentially unrelated group of people who are coming to talk to you, that is intentional, and it's meant to highlight two things. One, the fact that all of us can have a role in building a culture of physical activity and walking, and second, that all of us must. And they are here to share some exciting announcements about commitments they are making in response to our Surgeon General's call to action.
Visit us on the internet at www.pedestrians.org.